Hi, my name is Yahida, and I'm going to be doing a trigger of the perinasal sinuses. The projections that we're going to be doing are going to be the lateral perinasal sinus, and that is going to be at a technique of 85 at about 3. The next projection that we're going to do is APA Caldwell frontal and A anterior ethmoid sinus. With that projection, we're going to be using a technique of 85 at about 7. Our next projection is going to be a parieto-acanthial waters maxillary sinus. My technique for that is going to be 85 at about 8. And then our final projection is going to be the submental vertex, SMV, ethmoid, and sphenoid sinus. And my technique for that is going to be 85 at about 14. For all my projections, I am going to be at a SID of 40 inches, and I am going to be collimated to an 8 by 10 or a 10 by 12. So I'm going to go ahead and first I'm going to make sure that my room is set up and that I am detented. So now that I am detented, I'm going to go ahead and call my patient. Anne-Marie Montalvo. Hi, my name is Yahida. I'm for radiology. I'm going to be taking some x-rays. Can I get your full name and date of birth?
Anne-Marie Montalvo, 51580.
Okay. And is there any chance of pregnancy?
No.
Okay. Do you have any history of high blood pressure, diabetes?
No.
Any heart or lung conditions?
No.
Okay. So for the exam, you're going to have to take out any hairpins, if you have any, and also if you're wearing any dentures.
No, I don't have any of that.
Okay. So if you can just have a seat here on the chair. I'm going to go ahead and show my patient. So if you can go ahead and just kind of turn facing forward. So my first projection is going to be my lateral projection, and my central ray is going to be a half an inch to an inch posterior to the outer canthus. My RAO and LAO, I'm either going to be in an RAO or an LAO position, and for her, she's going to be in an RAO. My mid-sagittal plane is going to be parallel to the IR, and the interpupillary line is going to be perpendicular. My IOML is parallel to the front edge of the IR. So I'm going to go ahead and position my patient. So if I could just have you look to your left. Have you just take the stroke and put it to the back. My right marker indicating that it's my patient's right side. So go ahead and hold still. So go ahead and take a deep breath in and hold it and x-ray. So the next projection that I'm going to do is going to be the PA Caldwell. And for this projection, my central ray is going to be horizontal and it's going to be exiting the nasion. And I'm going to place a sponge to form a 15-degree angle with the IOML. The nose is going to be on the IR and the mid-sagittal plane is going to be perpendicular to the IR. So you can just go ahead and face. So I'm going to be using my left marker indicating that it's the patient's left side. Okay. So go ahead and take a deep breath in and hold it, x-ray. Go ahead and take this. And the next projection that I'm going to be doing is going to be the parieto-acanthial waters for the maxillary sinus. My central ray is going to be horizontal, exiting the acanthion. My chin is going to be on the buccal with the mid-sagittal plane that's going to be perpendicular to the IR. The OML forms a 37-degree angle from the plate of the IR, and the MML is approximately it's going to be perpendicular to the IR. So have you just scoot into the take your chin off just for a second. Bring your chin back. And again, I'm going to place my left marker indicating that it's my patient's left side. Okay. So go ahead and take a deep breath in and hold it and x-ray. So the next projection that I'm going to be doing is going to be the submental vertex, ethmoid, and sphenoid sinus. My central ray is going to be horizontal and perpendicular to the IOML, and the mid-sagittal plane is going to be 3/4 anterior to the EMA. My mid-sagittal plane is going to be perpendicular to the IR, and my IOML is going to be parallel to the IR. So if I can have you turn around. I'll have switch my shield around. And then you just scoot forward a little bit. And then I'm going to have my patient tilt their head back. patient's right side. Okay, let's go ahead and hold still. So go ahead, take a deep breath in, hold your breath, and x-ray. Okay, you can go ahead and relax. So that concludes my projections for the sinus. So now that we finished our projections for the sinuses, we're going to go ahead and evaluate some of the images. The first image that we're going to evaluate is going to be our lateral projection. And the evaluation criteria for this projection is you want to see all 4 sinus groups, but the sphenoid sinus is best demonstrated. No rotation or tilt of the sinus anatomy, and this is demonstrated by the stella turcica in profile, superimposed orbital roofs, superimposed mandibular rami. And some of the structures that you're going to see is going to be, you're going to have the frontal sinus, you're going to see the stella turcica, you're also going to have the ethmoid sinuses here and here, and then you will have the maxillary sinuses. The next image that we're going to be evaluating is going to be the PA axial, which is a Caldwell method. And in this image, the evaluation criteria is going to be the frontal sinuses are laying above the frontal nasal suture and the A anterior ethmoid air cells lying above the petrous ridges. You're going to have no rotation, and this is going to be demonstrated by equal distance between the lateral borders of the skull and the lateral borders of the orbits. The petrous ridge symmetric on both sides. The mid-sagittal plane of the head aligned with the long axis of the collimated field. You're going to have the petrous ridge laying in the lower third of the orbit. And some of the structures that you're going to see in this projection are going to be the frontal sinuses, which are here. You're going to have the ethmoid sinus, they're A anterior, which are here, and then you'll have the sphenoid sinuses, which are here. And then you have the petrous ridges lying in the lower third of the orbits. The next image is going to be the parieto-acanthial projection, which is the Waters method. And for this projection, the evaluation criteria is going to be, you're going to see the maxillary sinus. You're going to have the OML in proper position, and this is demonstrated by the petrous pyramids laying immediately inferior to the floor of the maxillary sinuses. You're going to have the no rotation, and this is demonstrated by equal distance between the lateral borders of the skull and the lateral border of the orbits on both sides. Orbits and maxillary sinus symmetric on each side. The mid-sagittal plane of the head is aligned with the long axis of the collimated field. And some of the structures that you're going to see are going to be the frontal sinuses, which are here. You're going to have the ethmoid sinuses here. You have right and left maxillary sinuses. You're going to have the petrous pyramids, which are lying inferior to the maxillary sinuses, and then you're going to have here in this area is a mastoid air cells. The final projection that we're going to be evaluating is the submental vertical projection, which is a SMV. And some of the evaluation criteria for this is going to be the sphenoid and the ethmoid sinuses are in profile. You have no tilt, and this is demonstrated by equal distance from the lateral border of the skull to the mandibular condyles on both sides. The IOML is positioned parallel to the IR. This is demonstrated by superimposition of the A anterior frontal bone by the mental protuberance. And then you have the mandibular condyle A anterior to the petrous pyramids. And some of the structures that you're going to see on this image are going to be the maxillary sinus, which are here. You're going to have the ethmoid sinuses, which are here. You're going to have the mandible here. You have the vomer, which is right here. You have the sphenoid sinus, which is here. You're going to have the pharynx here, and then you have the petrosa, which is here. And that concludes the evaluation criteria for the sinus projections.